Today we're going to talk about Rizatriptan under the brand name Maxalt. We will explain its mechanism of action, its side effects, its dosage, its warnings and its interactions. What is Rizatriptan? Rizatriptan is a medicine used for the treatment of migraine with or without aura. The brand name of Rizatriptan is Maxalt, Maxalt-mlt. The product ingredient is Rizatriptan benzoate. Mechanism of action of Rizatriptan. Selective agonist of the 5-HT1B/1D receptors involved in cranial vascular contraction, inhibits trigeminal activity. Therapeutic indications, uses and benefits of Rizatriptan. Acute treatment of the headache phase of migraine attacks with or without aura. Posology of Rizatriptan. Oral, adults, a dose of 10 mg. If there is a response to the first dose but symptoms reappear, a second dose may be administered within the following 24 hours, provided that there is a minimum of 2 hours between the two doses. If there is no response to the first dose, do not administer the second dose. Maximum 2 doses in 24 hours. Faster effect on an empty stomach. 5 mg dose, maximum 2 in 24 hours, in patients with mild-moderate liver failure, mild-moderate renal failure or taking propranolol. Contraindications of Rizatriptan. Hypersensitivity. Use with ergotamine or derivatives, including methosergide, or other 5-HT receptor agonists with MAOI or in the next 2 weeks. History of AMI, stroke or TIA. Heart ischemia, angina pectoris, silent ischemia, Prince-Metal's angina, peripheral vasculopathy. Moderate severe or mild uncontrolled DTS. Severe HI. Severe I. Rizatriptan warnings and precautions. Do not use under 18, or over 65, or prophylactically. Not indicated for hemiplegic or basilar migraine or atypical headaches. Caution in patients at risk of coronary disease or unidentified heart disease, or taking hypericum, or with SSRIs, SNRIs. Stop treatment in the event of angioedema or suspected ischemic heart disease. Risk of chronic/exacerbated headache due to excessive use. Liver failure and Rizatriptan. Contraindicated in severe liver failure. Dosage of 5 mg, maximum 2 in 24 hours, in patients with mild-moderate liver failure. Renal insufficiency and Rizatriptan. Contraindicated in severe renal failure. Dosage of 5 mg, maximum 2 in 24 hours, in patients with mild-moderate renal failure. Rizatriptan interactions. Increases risk of coronary vasospasm with ergotamine and derivatives, and with other 5-HT1B/1D agonists. Leave 24 hours between administration of ergotamine or derivatives and Rizatriptan, and 6 hours between Rizatriptan and ergotamine or derivatives. AUC increased by MAOI, association contraindicated. AUC augmented by propranolol. Serotonergic syndrome with SSRIs or SNRIs. Inhibits metabolism of CYP2D6 substrates. Adverse reactions increased by hypericum. Pregnancy and Rizatriptan. Security not established. Animal studies do not indicate harmful effects at higher than therapeutic doses. As animal reproduction and development studies do not always predict human response, only use when strictly necessary. Breastfeeding with Rizatriptan. Studies in rats indicated a very high passage of Rizatriptan into the milk. Very slight transient decreases in preweaning body weight of pups were observed only when the mother's systemic exposure was well above the maximum human exposure level. There are no human data. Therefore, care should be taken when administering Rizatriptan to nursing mothers. Infant exposure should be minimized by avoiding breastfeeding for 24 hours after treatment. Effects on Rizatriptan driving ability. Migraine or Rizatriptan treatment can cause drowsiness. Patients should be advised to assess their ability to perform complex tasks, such as driving, during migraine attacks and after administration of Rizatriptan. Adverse reactions and side effects of Rizatriptan. Paresthesia, headache, hyposthesia, decreased alertness, tremor, palpitations, tachycardia, flushing/sophagia, pharyngeal discomfort, dyspnea, nausea, dry mouth, vomiting, diarrhea, sweating, regional heaviness, abdominal or chest pain,